Have you ever stopped to think about your health, especially your heart health? Well, heart disease is the number one killer globally, and India holds the unfortunate title of being the heart disease capital. So let's discuss and know more about heart failure in our today's episode. Hi, this is Dr. Lakshmi, and you're watching Yashoda Hospital's The Health Talk session, where all your health-related queries are answered here. Joining our discussion today is Dr. Rajasekhar V., Senior Consultant, Interventional Cardiologist and Electrophysiologist and Clinical Director from Yashoda Hospital's High-Tech City. Welcome to the program, Doctor.
Thank you.
So, Doctor, heart failure is a critical condition affecting the heart where millions of people are getting affected globally, and we pose a significant health challenge, especially in our country. So to begin with, could you explain what exactly heart failure is?
So when we speak of a condition called heart failure, we often create a wrong impression in the minds of the lay public. So people think that when you say somebody is suffering from heart failure, they often end up assuming that the heart has stopped working. That is not the case. When we say heart failure, we mean that the heart is failing to perform at a level that is required for the body's daily functions. So normally when the heart is functioning normally, the pumping of the heart, the amount of blood that it pumps, is dependent on the amount of blood that is required by the body, depending on the activity. When the heart muscle gets damaged or it's not able to function as per the requirements of the body, then arises a condition that we refer to as heart failure. So basically what happens is the heart is normally producing a certain amount of output every minute. So that output is decreasing. So the amount of blood that the heart is able to pump out with each contraction is decreasing. The most important consequence is then there is build-up in back pressure. Because the heart is not able to pump out the blood remains in the heart, and this creates a back pressure that causes congestion in the lungs. So that will cause breathing trouble, accumulation of fluid in the lungs, and that causes inability of the individual to lie down flat, and the individual becomes very breathless. Similarly, over a period of time, there will be back pressure changes causing congestion in the entire body, a condition that we refer to as congestive cardiac failure or congestive heart failure.
The recent trend suggests that there has been a significant increase in people suffering with heart failure, as we discussed earlier, and most of them are falling below the age of 60 or 65. So what are some potential risk factors?
The risk factors for heart failure are hypertension, diabetes, and coronary artery disease. That is a disease that affects the blood supply to the heart. As the risk factors keep increasing, the direct consequences is the deaths due to heart failure keep increasing. And in addition to that, the other risk factors such as smoking, sedentary lifestyle, most important genetic factors. People who have a family history of heart disease at a young age, they're more prone to develop these kind of problems. Lack of physical exercise and abnormal blood cholesterol. So these are all the risk factors. As these risk factors increase, and why are these risk factors increasing? It's increasing because we are getting increasingly urbanized and westernized in our lifestyle, and as a consequence, our dietary habits have gone astray. So from whole grains, organically produced fruits, vegetables, from a diet that is rich in whole grains, fruits and vegetables, we are going into more processed foods, having more content of refined sugars and more trans fats and more unhealthy fats in the diet. These are all contributing to blood cholesterol and building up of plaques in the arteries of the heart. And in addition to that, the stress of modern life, especially in the younger individuals, because of more sedentary style of working. Most of the professions involve working at a desk in front of a computer, long hours of sitting. One interesting fact that has come up that people are beginning to understand recently is that sitting is as harmful as smoking.
Yeah, sitting is the new smoking, they say.
Sitting is the new smoking. So jobs that require prolonged sitting for prolonged periods of time, which do not involve physical activity. So these predisposed again to heart attacks.
So are there any symptoms or warning signs that we could all be aware of so that we could take some precautionary measures or we could visit our cardiologist as soon as possible?
Yes. Like the most important thing about heart failure is to diagnose and detect and treat it even before it occurs. How do we detect heart failure even before it has occurred? So that is treating at the stage of the risk factors. Somebody who's got hypertension, which is uncontrolled, has diabetes, which is uncontrolled. Somebody who's got coronary artery disease. These are all subsets of individuals which are likely to develop heart failure in future. So you treat them at this stage. Treat their hypertension aggressively. Make sure that the blood pressure is under control and remains under control with diet, lifestyle, and drugs. Second thing is to pick up the early signs of incipient heart failure. Like somebody complains of fatigue, so getting easily tired, getting slightly breathless on an activity that he or she would perform quite comfortably earlier. So when we can identify at this stage, and if you can aggressively treat both the predisposing factors as well as the heart failure itself, it is possible to reverse some of these changes. And also there are drugs now which, when started at the right time and in the right doses, these drugs also help in reversing some of the changes that have happened in the heart in heart failure.
So in certain individuals, when heart failure is detected at a later stage or when drugs have failed to keep the heart health under control. So what are some latest minimally surgical interventions which we have seen in cardiology today, doctor?
One is the recognition. We are now better equipped to recognize different forms of heart failure, and we are able to act earlier in the spectrum of the disease. Second is there have been several new drugs which have come up, which have been very effective in not only improving the quality of life and symptoms of the individual, but also helpful in prolonging the survival or prolonging the lifespan of the individual. So, but there comes a stage in some heart failure patients when, in spite of maximally given and optimally treated medical treatment, they continue to have symptoms. They continue to have frequent hospitalizations. For some of these patients, there are some devices, especially there are in some individuals who have heart failure, they have a problem with cardiac synchronization. Their heart contraction is not synchronized because different areas of portions of the heart are beating at different times. They are not synchronized in their beating, so that reduces the efficiency. For some of these individuals, if we identify this lack of synchrony, we implant a device called a cardiac resynchronization pacemaker. So this cardiac resynchronization pacemaker will synchronize the different areas of the heart to contract together, thereby increasing the efficiency of the heart. So this is one important advancement. In addition, some of these heart failure patients have a risk of having a sudden cardiac arrest. That's because of the enlargement of the heart and damage to the electrical system inside the heart. So they can have erratic heartbeat, which can cause a cardiac arrest. When there's a cardiac arrest, the person has to have a CPR and get an electric shock to be revived, short of which the person will not survive. So if it happens outside the hospital, the chance of survival is much less. In these individuals in whom we identify them at risk of having a sudden cardiac arrest because of heart failure, we implant a device called an implantable cardioverter defibrillator. And beyond that, there comes a stage that nothing works. Then some of these patients are lined up for heart transplantation surgery, which is obviously a definitive treatment. And there are some devices called ventricular assist devices. These also are like something like an artificial heart, which have a small pump, and these are surgically implanted devices. Some of these devices are used as destination therapy for patients who are not fit for heart transplantation, or as a bridge therapy. In a nutshell, this is about the advances in the treatment of heart failure that
we have seen recently.
Yes.
So if we have to talk about lifestyle modifications, apart from diet and exercise. Is there any role of sleep or a good amount of sleep? Do you think it's necessary to keep your heart healthy?
Yes, I think there is mounting evidence in medical literature that shows that if the sleep duration is less than 7 hours, average less than 7 hours in an individual, it starts to increase your risk of developing heart attack and heart disease. So the sweet spot for sleep is 7 to 9 hours. So minimum is 7 hours, and between 7 and 9 hours is the best duration of sleep for an individual. Basically, sleep is a mechanism to restore the body and to rejuvenate the body. And it's very important in terms of reduction of the risk of heart disease. You also heard of the actress Sushmita Sen having a heart attack, and some athletes having a heart attack, or
in spite of being fit and having a very healthy lifestyle.
So the one important factor in them could be this lack of adequate sleep.
So before we wrap this episode, Doctor, is there any message that you would like to share with the audience out there as far as heart disease is concerned?
Heart disease is a growing epidemic in this country, and we in India have become the capital of heart disease in the world. That's because of several reasons. One reason, of course, is that as Indians, we are genetically more susceptible for heart disease. But other than that, there are modifiable risk factors which are hypertension, diabetes, poor lifestyle, poor diet, lack of exercise, all of which are contributing to the increased incidence of heart disease in India. So what is important for us to realize is that we have to aggressively target the modifiable risk factors, such as control our blood pressure, control our diabetes, maintain our body weight within the ideal range, have a lifestyle which involves healthy diet, regular exercise, avoid too much of sedentary activity, and then most importantly, have adequate sleep and reduce the levels of stress. And all this will go a long way in preventing heart disease. There are many advances and many technological advances in the treatment of heart disease, but the best way to treat heart disease is to prevent it.
So thank you, Doctor. It was wonderful having you here on the episode today.
Thank you.
So this brings us to the end of this episode. Remember, having regular heart health checkups and following a healthy lifestyle are a game changer. And don't forget to join us for next week as well. Until then, take care and stay healthy. Thank you.